change the world and help the most vulnerable communities among us, we as researchers need to be bold and use unconventional research methods to enact true, lasting, and sustainable change in the communities we study. My name is Dowhaniuk, and I'm a National Geographic explorer and PhD student at the University of Florida studying public health issues in Uganda and East Africa. Public health interventions are often developed in simple terms. A health issue is identified by experts, then a quick fix magic bullet solution is implemented to solve it. These technical solutions often fail due to not taking into account complex cultural factors underneath the surface. The leading medical journal, The Lancet, considers the systematic neglect of culture and healthcare to be the single biggest barrier to the advancement of the highest standard of health worldwide. The systematic neglect of culture helps to explain why simply providing free contraceptives often fails because it doesn't consider gender power differences that make it difficult for women to demand for a man to use a condom. It also explains why the 2014 West Africa Ebola outbreak could not be solved simply through technical efforts. A lack of cultural awareness resulted in up to 80% of transmission cases being due to traditional cultural practices. Following this outbreak, the World Health Organization explicitly recognized the importance of working with culture, not against it, and that technical solutions always fail when faced with entrenched cultural practices. In the fall of 2018, I will travel to Northern Uganda, in a region where the Ugandan government fought a 20-year civil war with Joseph Kony and the Lord Resistance Army until 2006, during which public health infrastructure was decimated. For my project, I want to change the status quo in research and give true voice and power to the community in every stage of the research process. Communities will define the health issue that negatively impacts their lives most on a daily basis using photography to effectively communicate health issues across cultural and linguistic barriers, with the incorporation of the resulting photos in interviews and group meetings. After the health issue is identified collaboratively, I will then research the health issue and underlying cultural and social factors in depth through individual interviews and work with community members to build and implement a community-driven, ground-up intervention based on the results of this study. So, I want to ask you to join me by contributing to my efforts in Northern Uganda to improve public health. Together, we can change the world. Please, even the smallest donation helps, or share this video with your friends, family, and colleagues. My name is Dowhaniuk, and I want to give a voice and power back to the communities in the research process and create new, innovative solutions to today's most pressing public health problems.